Klebsiella, Pseudomonas aeruginosa, Clostridium difficile, E. coli. You're probably thinking, what are you saying? Well, for those of you that work in the healthcare scene, you should know what most of these are. These are names of bacteria, and these bacteria can live on our bodies, especially on our hands. Bacteria can reproduce in just a matter of 20 minutes and can be spread in a number of ways. Something else that's pretty shocking is that there is more bacteria on our bodies than there are human beings in the United States. That's a lot of bacteria and a lot of bacteria to be spread. So what types of bacteria are on our body? Well, you've got your resident bacteria. Think about the word resident. It lives on our body. And in a normal human being, a normal healthy human being, it's not harmful. But then you have your transient bacteria, and this bacteria is what's transferred to us, person to person, surface to person. Think about all the things that you touch during the day. Doorknob, a car door, money. According to WebMD, some of these viruses, those things that give us the common cold, can live on surfaces for hours. And regular hand washing is the best strategy in preventing these viruses getting inside of our body. But you need to ask yourself, just how effective are you being with your hand washing? And we'll get to that a little bit, just how effective we really are at it. Michigan State University, their researchers did a camp out in some bathrooms and found that only 5% of the people washed their hands long enough after using the bathroom, and only 23%, out of that 23%, they did not use soap. 23% did not even use soap. I can't imagine using the bathroom and not washing my hands with soap. So, working in the healthcare scene, you come across a number of patients, and we can help prevent the spread of infection and those colds just simply by washing our hands. Think about it. Put yourself in your patient's shoes. Would you want a nurse coming in and redressing that wound if she hadn't even washed her hands, not even putting gloves on, but washing her hands? How would you like it if your surgeon, if you went to surgery and your surgeon didn't wash his hands? So think about it. And I know that there's times when we as human beings, we tend to get lazy with it. We have jobs, we have families, we have errands to run, we have school, and we tend just to be lazy about it. Dr. Ignaz Semmelweis did a study about 150 years ago, and he had his student physicians wash their hands before going and rounding on their maternity patients. They had been working on corpses, and he found out that evidence showed that this experiment that he did was successful whenever maternity deaths decreased 50-fold. So you as a healthcare professional, you need to do yourself a favor, and you need to do your patients a favor. Wash your hands the correct way. Think about that you come in contact with these patients, but also with their families. You shake their hands. You give them a hug. Dr. Elaine Larson, Dean of Research at Columbia University School of Nursing, said that handshakes are riskier germ-wise than flushing a toilet or even grabbing a subway pole. I wouldn't think that. So you need to remember that just because that your hands don't appear to be soiled doesn't mean they're not. So anytime that you think about it, go wash your hands. Use an alcohol-based hand sanitizer in between your hand washings. According to Potter and Perry's Basic Nursing Essentials for Practice, 6th edition, the most important and most basic technique in preventing and controlling the transmission of infection is hand hygiene. I mean, this isn't a Weight Watchers program. You can't just up and skip a day. There was also an Operation Stop Cough that was done at a military base in Illinois. And this was a Navy recruit base. And they had their recruits wash their hands at least 5 times a day. And for 2 years, there were 45% fewer respiratory illnesses than when there was the year before they started this operation. The Centers for Disease Control and Prevention explained to us the correct way of washing our hands. It's pretty simple. You turn the water on, you wet your hands. You turn the faucet off, and then you put soap on your hands. Rub your hands, scrubbing them vigorously. Now, don't scrub them to the point where you're scrubbing your skin off. 20 seconds, scrubbing your hands, creating that friction. And then you're going to want to rinse them. Now, at this point, get a couple of paper towels. Turn off your faucet. You don't want to touch your clean hands after you've rinsed them and turn the faucet right off. That faucet's dirty. So take a couple paper towels, turn the faucet off. Then you want to pat your hands dry. It's pretty simple. So do yourself, do your family, do your patients a favor. Wash your hands correctly. It's not that hard. And if we just take a good 30 seconds to do this, we will hopefully prevent and control the spread of these nasty colds out there.